News tonight, the Federal Trade Commission may be conducting a study on the Ballad Health merger. Ballad Health CEO says a study would be premature, but others say more information on certificates of public advantage is imperative. FTC officials say the study has yet to be authorized, and it would take several years to gather meaningful data on the merger's impact. News Channel 11's Jackie DeFusco reports from Washington, D.C.
The agreement that created Ballad Health could become a model for other states in the future. I'm Jackie DeFusco, and I traveled to Washington, D.C., where our region's healthcare was among the focuses of a Federal Trade Commission workshop. After adamantly opposing the Ballad Health merger,
we know that there is a large body of empirical research that suggests that competition is beneficial in healthcare markets.
The Federal Trade Commission is now looking for answers.
We realized that there's very little known about the actual effects of COPAs in healthcare markets.
Ballad Health could be their next case study. The question, are COPAs actually improving healthcare access, quality, cost, and innovation?
There needed to be clear and convincing evidence of a public advantage. I don't know that that threshold has been met yet. I think that that's something that needs continued oversight.
At an FTC workshop, a member of Ballad's local advisory council accused the hospital system of shifting outpatient services to inpatient settings to raise prices.
There is zero evidence that pricing has gone up more because of the merger.
In March, News Channel 11 reported that some cancer patients would have to pay an additional fee after treatment was moved to the Indian Path Hospital campus.
Assigning blame to Ballad for something that's going on all over the country is not fair.
Levine says facility fees help hospitals recover the cost of charity care. The move also means they can take advantage of a federal drug discount program.
If it weren't for the 340B program, there would be hundreds of people in this region that would not be getting cancer care.
Critics also contend that Ballad Health is restricting access to care with its plan to consolidate Level 1 trauma services in Johnson City.
I believe that the geography would demand that those types of service be centrally located to the region.
Levine says savings from consolidation are critical to help keep rural hospitals open. Ballad is required to maintain these facilities for 5 years under the COPA.
If you can't consolidate and you can't achieve those synergies, the ability to keep these rural hospitals open goes away. That's why the state agreed to let us do this.
Ballad has also committed to reinvest more than $300 million to improve the region's population health. Their progress on dozens of metrics is being tracked, but Ballad won't receive its first grade until next spring.
The fact that the state of Tennessee and Commonwealth of Virginia were unable to score this COPA means that they cannot determine that this COPA has been a clear and convincing advantage to the public. And if you cannot determine that, then it should not progress.
At Kingsport's Holston Valley Medical Center, a 50-plus day protest and a petition with more than 23,000 signatures asks Ballad Health to delay further merging of their assets, a step policy experts say is difficult to undo.
It's not easy to unscramble the eggs. Once you've merged two entities and they're integrated to some extent.
The Federal Trade Commission will be collecting public comment on your experiences with COPAs on their website until July 31st. In Washington, Jackie DeFusco, News Channel 11, in your corner.
And that was the first of a three-part series airing this week on the Federal Trade Commission's workshop. Stay with News Channel 11 tomorrow and Wednesday as Jackie continues to unpack this complicated policy of COPAs.